I would say healthcare costs or medical expenses is one of the biggest concerns that I hear people talk about in retirement. They worry about what happens if I go into a nursing home, or as my health declines, will I be able to have the funds to be able to support those expenses? And so having a plan that not only allows you to cover those expenses, but to ensure that your dollars are keeping up with inflation to cover those expenses is so important. So the first thing is it's important that you have a plan that is keeping up with inflation. If it's not keeping up with inflation, that means it's also not going to keep up with the medical costs and healthcare expenses. In addition to that, though, another key part of the perennial income model is that we usually like to end with the plan with the same amount that you start with at the beginning of your retirement. And that's what we call our legacy segment. And although it's not necessarily a legacy that's passed on to kids, unless there is something a little bit left over for after you pass, it's actually designed to provide that buffer just in case if you do live longer than the initial plan that we put together, or what if you do have a long-term care event that causes you to go to a nursing home facility. And by having that buffer, it allows retirees to not only draw their monthly income as planned, but to have this pot of money that they could also tap into just in case, with nursing costs and medical expenses, continuing to rise over time. Having that resource can provide a safety net for retirees. Believe it or not, every decision you make about retirement affects each other. So decisions made about your investments can actually influence what happens to your health insurance. Specifically, as an example, your income that you report on your taxes has a direct impact on your Medicare Part B and D premiums. Having a plan that coordinates your healthcare decisions as well as your investments and taxes is so important to make sure all of your resources are coordinating together. Most people, when they enter retirement, are familiar with a statistic that a lot of people hear about, which is 70% of retirees are going to have some form of long-term care event during their retirement, which is true. It is an accurate statistic. But what they don't tell you is how long those long-term care events last. On average, it can last between 1 to 5 years. And so making sure you have a plan on how to provide funds or money to cover those expenses is so important. So generally, for most retirees, having that legacy segment of the perennial income model to provide that resource, that safety net, is a great way to provide those funds for the long-term care at some point during their retirement.